Good morning, everyone. Welcome. I'm Dr. Linda Colley. I'm a clinical lead for Health and Care Portsmouth of Hampshire and Isle of Wight ICB. There is limited public seating available. However, the meeting is also being webcast to allow the public to attend remotely if they so wish. For housekeeping, if the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble in the turning circle at the end of King Henry Street past the University Park building. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that the meeting will be live streamed. Everyone speaking via microphone will be on camera, including those making deputations. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphones? You can bend them towards you and remember to turn them off when you have finished speaking. We have read the report, so presenters please only highlight any developments that have occurred since publication. And finally, I'd like to invite you to move through to the Lord Mayor's parlour for lunch after the meeting. So if we go around the room now for introductions, please, starting to my left.
Mike Stoneman, Deputy Director, Education.
Dominique Latouze, Assistant Director of Public Health.
Anna Martin, Democratic Services.
Sam Graves, Community Safety Analyst.
Matt Gummerson, Assistant Director of Public Health.
And Kayla Nash, Strategy Unit City Council.
Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care and Co-Chair of the Health and Wellbeing Board.
Andy Biddle, Director of Adult Social Care, Portsmouth City Council.
Phil Foxton, Hampshire and Isle of Wight Farm Rescue Service.
Councillor Susie Horton, Cabinet Member for Children and Families and Education.
Bernie Allen, Deputy Place Director, Portsmouth, NHS Hampshire and Isle of Wight.
David Goosey, Chair of the Safeguarding Adult Board.
Miriam Hargreaves, Manager of Vista.
Shumala Dana, Chair of Portsmouth City Centre.
Lorna Reevely, Chief Officer of the Hive Portsmouth.
Councillor Raymond Dent, Copner Ward.
Graham Terry, Director of Strategy, Portsmouth Hospitals.
Roger Batterbury, Chairperson, Health Watch Portsmouth.
Jason Oakley from the University of Portsmouth.
Caroline Hopper, Strategy, Portsmouth City Council.
Helen Atkinson, Director of Public Health. Gemma Nichols, CEO, Portsmouth Creates.
Councillor Graham Heaney, Deputy Leader of the Labour Group. Apologies, I'll have to leave before 12 to go and deliver a lecture at the university.
Thank you very much. And we have had some apologies for absence. So we've had apologies from Sarah Beattie, Natalie Brammer-Pell, Sarah Daly, James Hill, Superintendent Paul Markham, Terry Norton, Joanne Shankland, Francis Soul and Penny Emmerich, but thank you, Graham, here on her behalf. Lovely. So is there any specific declaration?
Can I just give apologies for lateness from Councillor Steve Pett?
Lovely, thank you. Oh, yes,
Just had apologies in from Diane Sherlock of Age UK.
Thank you. Lovely. Do we have any declarations of interest specifically to these items today? No. If we look at the minutes of the previous meeting then, which was on the 25th of September, has anyone got any comments or corrections to be made to these? Are we happy they're a fair reflection of the meeting? Lovely, thank you. And I don't believe there were any outstanding actions. Is that correct, Anna? Was there any? I can't see any. Was there any documented somewhere?
Just this one here.
Summary of restorative. Oh, we're going to have a verbal update of that one, are we? It's not on. Where is it on? Sorry, is it on the back of that? Ah, perfect. Thank you. So, Dr. Jason Oakley was going to give a verbal update. Is that correct? Yeah, lovely. Over to you then, please.
So this was just an update on the Restorative Relationships conference that took place. Sorry, word is being very slow. So we had a Restorative Relation Practice Conference on July the 15th, 2024 at the University of Portsmouth Eldon building. The event continued on the successful series of quarterly workshops from 2023, bringing together practitioners from public and voluntary sectors. Key highlights were a number of featured talks and workshops, and we'll circulate a paper post this so people can see what the list of those are. It was a really successful day. I think we're hoping to build upon that now with a series of monthly events at the Oasis Centre, whereby we can actually bring more people together to see what happened on the day, because obviously people couldn't get to everything. But I think it was a really great example about how the local organisations can come together and then bring together people from right across the community, from different sectors, to actually work together to look at how we can actually sort of look at restorative practice in a really, really informative way. So a single side of A4 will come out after this with the list of speakers, and anybody can always contact me if they've got any questions or would like to follow up on any of the points that are therein.
Lovely, thank you. So we'll move on to our first of the main agenda items, and that's the Safeguarding Adult Board. David, please. Thank you.
Thank you. You've had the report in the pack, and in it I think there are a number of items that set out the achievements of the multi-agency group over the year 23-24. But I'd just like to emphasise the serious adult reviews that are also described in this board report. There are 11 new referrals for serious adult reviews during the year. 2 went forward to a full safeguarding adult review. But we also published 3 serious adult reviews during the year. And it's interesting just to think a little bit about some of the common themes across those 3 tragic cases. Kim, a 30-year-old, 8-month pregnant young woman who was homeless and experiencing significant substance misuse, domestic violence, mental health issues, was in the rough sleeping pathway, but she died sadly, as did her unborn child. And the analysis of the circumstances leading to her death indicated to us that there was indeed much more work to do on the multi-agency working together approach. Some of the activities associated with services towards her really weren't person-centred enough. But she was also a young person with some significant complex health and social needs, and was being marginalised, largely speaking, by some of those services. Similarly, when we look at the experience of Paul, who's a 50-year-old veteran, who was also homeless and had mental health difficulties, who died by suicide. Housing services were clearly stretched in terms of helping him, but there was certainly a sense in which services didn't really know enough about his mental health condition, didn't know that he was a veteran, and our multi-agency risk assessment framework really didn't work sufficiently well in that context. And similarly for Ronnie, who was a 40-year-old man, also using substances, was homeless and in the rough sleeping pathway, died by assault by 2 other residents. There was certainly some significant indications that there was unconscious bias amongst the services looking at his needs, in so much so that he wasn't seen as being vulnerable. One of the key things, I think, in respect of these 3 people is that none of them met the statutory criteria for a safeguarding investigation. And so it points, have other serious adult reviews in the past, to the continuing need to progress that multi-agency risk assessment approach that is just below the statutory threshold. The board has been progressing developments along those lines, that risk assessment management framework, for a number of years. And we've updated it again this year, but to be honest, what it needs is resource. Now, slightly changing the subject, I have in the past at this board meeting criticised the ICB for not servicing the Portsmouth Safeguarding Adult Board sufficiently. And we have lobbied and lobbied the ICB continually over several years. I'm delighted to tell you that we've been successful. And I want to pay tribute to the Safeguarding Director at the ICB, Fiona Holder, for making a difference. We've had, are going to have in 2025, a substantial increase in funding from the ICB, which I think for the first time allows the board and the adult services team in Portsmouth to properly resource that multi-agency risk assessment framework. Proposals are being developed and I'm hopeful that that will make a substantial difference. There are other achievements that are set out in the report. Notably, I think the engagement subgroup, which is working really, really hard to work with local communities to develop and co-produce safeguarding responses to those people that we wouldn't ordinarily have some focus on. And I think that is really paying dividends. Thank you.
Thank you. Any comments or questions? Yeah, Councillor Winnington.
Thank you, and thank you for the report, and as ever, extremely thorough and gives a really great impression of the work you and your team do, and also all the members of the Safeguarding Adults Board in the city. Other than that, I'm just going to reiterate the thanks that David has given at the end. It's taken a huge amount of time, but we are finally properly getting the proper funding we need for our Safeguarding Adults Board, and we cannot underestimate how important that is for this city, for the general needs of people in terms of safeguarding, but also when we've got, we now have inspection incoming. It's a really important part of that, is showing that we are able as a city to respond to safeguarding concerns and being able to action things. I'd also like to thank all our partners as well. Some of the reports that have come through show where we still need to do better. But it also shows the engagement that partners across the city do. And I'd also like to thank, in terms of our the engagement that's gone on in engaging people right across this city through events and through the Safeguarding Adults Board, in terms of making sure that safeguarding is everyone's business in Portsmouth. It isn't just the business of social services or the NHS. It really does go well beyond that. So thank you so much for the report, and thank you for all the work that everyone does in the city around safeguarding, and David for your leadership on that.
Thank you very much. So we'll now move on to the Community Safety Strategic Assessment, and Matt is going to start us off, I think, is that right?
Good morning. Community safety analysts sit within the Public Health Intelligence team, which is why I'm introducing this report. But Sam's work is very much on behalf of the responsible authorities that have the statutory responsibility to produce an annual plan, a plan and a strategic assessment that informs that. We've got a new community safety focused subgroup that we've established of this board since last year when we presented the update, and that group's really moving forward, and we'll be looking at the prioritisation process that follows from this strategic assessment. So slightly different this time. We're just presenting the findings rather than the priorities. That will come later in the year once that group has worked through that. And this year we've also changed the name. So it was previously called the Strategic Assessment of Crime, Antisocial Behaviour, Reoffending and Substance Misuse. A bit of a mouthful, reflected some changes to bring those things together into the report, but I think we can safely just call it the Strategic Assessment of Community Safety now. So that change was agreed at the subgroup, and hopefully you're happy with that as a board. It also reflects the fact that it includes other things within it that aren't covered even in that mouthful of words. Okay, thank you. Bear with me a second while I just make the tech work. Hopefully. That will do the trick. No. Okay, bear with me a second, just while I figure that out. And while I'm doing that, there you go. Just to say as well, we are working with the Office of Police and Crime Commissioner on the strategic assessment of serious violence that we did last year as a joint piece of work across Hampshire and the Isle of Wight. So we have district level, or in our case, Portsmouth level, chapters within that that are also form part of the force-wide assessment. Because of the kind of timings of doing that, that piece of work isn't quite complete, so the Portsmouth chapter of that will slot into this strategic assessment, but the work is being done by Sam for Portsmouth in both of them, and the data is all the same, so it won't contain anything that isn't already covered within this, but we will incorporate that serious violence chapter in here when it's complete. So, without further ado, I'll hand over to Sam, who's going to talk you through the main findings from the assessment, including the community safety survey carried out earlier this year.
Okay, thank you. So I'm just really going to give a very, very brief summary of some of the key findings from the strategic assessment of community safety, because a lot of that has already been presented to the subgroup as well, and the full document will be available soon, and you've had the exec summary. I will talk about the community safety survey in a bit more detail, because I think that's quite of interest to this group, and it's a nice big bit of work that we do. Thank you. So, police recorded crime has reduced by 8% since last year. But as with any data set, there are some limitations of police data. It's a great data set, it's very detailed. There's some limitations on there, but one particularly important limitation I do want to draw your attention to is a recent change in the way that police record crime. This is referred to as the principal offence rule. Where more than one offence is committed at the same time by the same perpetrator, only the most serious offence will be recorded. So where there's a couple of offences, say there's an assault and a shoplift or something like that, only the most serious will be recorded. So we would expect there to be a reduction in police recorded crime for that. If anyone's interested, you can Google it, and there is actually a list which ranks all the crimes in seriousness. So it shouldn't be a matter of judgment. There should be a formal process for that. But it does mean that some offences are not going to get picked up, which means that it makes it even more important that we consider other data sets, which I do as part of the strategic assessment process. And on consideration of all of the data sets that we have, the picture of crime across Portsmouth is actually pretty stable. Thank you. There's been reductions in most types of police recorded violence, but other data sets such as hospital admissions or our local community safety survey show that actually, again, over the last few years, violence has been very stable. There's been reductions in many types of theft, although there's been a substantial increase in shop theft reported to the police. That's a really similar picture across the whole of Hampshire and nationally as well. There has been a marginal increase in possession of a weapon offences, but those can be affected by police activity, and there has been an increase in knife-enabled violence. Domestic abuse recorded by the police has reduced over the last couple of years, but it does continue to be the largest known driver of violence, accounting for about 37% of assaults. We've also noticed that children known to be at risk of criminal exploitation has been increasing. Most of this is likely to be due to better awareness and referral pathways, but the missing exploited traffic team have noted that there could be a small genuine increase linked to local drug networks in the last couple of years. Talk about antisocial behaviour. There's been a substantial and sustained reduction in antisocial behaviour reported to the police over the last decade. But other data sources, notably our local community safety survey, show that antisocial behaviours remain fairly stable, really. We have seen increases in antisocial behaviour reported to other agencies, such as the Housing Antisocial Behaviour Unit, the Noise Pollution Team, and arson reports to the Hampshire Fire and Rescue Service. So it's likely that levels of ASB have remained fairly stable, but reported to different agencies or not at all. So moving on to the community safety survey, it's really important to us because it's the main way that we talk to our residents about their experiences and views of crime and antisocial behaviour in Portsmouth. We've been doing this survey since 1997 in various different formats, and we've been doing it in this format every 2 years since 2014. So that gives us some really great long-term data. This year, in February and March, we spoke to over 1,000 Portsmouth residents. And we do collect demographic information, and we monitor that as we're doing the survey because we want to make sure that it's representative of all our residents, and that includes the ward where they live, gender, ethnicity, disability, armed forces, etc. And this year, our sample was broadly representative. Ideally, we would have liked more participants from Paulsgrove and Drayton and Farlington, and the armed services community. With Paulsgrove and Drayton and Farlington, we did have field workers up in those areas, but we really struggled to get footfall in those areas. And so, always welcome any suggestions. But Paulsgrove Housing Office, which in the past has served us really well as a base, just didn't really have very much footfall for us. As you can see from the chart, the lilac line represents crime reported to the police, big increases after changes in recording in 2014, and then sort of a bit more fluctuation, whereas the crime reported to the survey has remained fairly stable, particularly over the last sort of 4 surveys that we've done. We're pretty sure that the changes that we've seen in police recorded crime are due to the way that the recording has changed over the time, and also there have been some new offences, such as stalking offences, that have been introduced. And our local survey sort of just helps reassure us that actually that's the case, and the Office for National Statistics also sort of hold that view about police recorded crime being due to changes in recording. We found that 44% of crime reported to us in the survey was actually reported to the police. That's less than half. That did differ for online crime. Only about 13% of that was reported to the police. As can be seen on the slide, the most commonly reported crimes were online fraud, threats or intimidation, and phishing. And that is where money or data was actually stolen, not attempts at phishing, which are very, very frequent. Most crime types have remained fairly stable or reduced since 2014. However, online crimes have increased during that time. We found that people's general fear of being a victim of crime hasn't changed since the last survey, with about 38% of people worried about being the victim of crime. But there's a really big mismatch between the crimes that people are most fearful of and those which actually happen to them. So, for example, a lot of people are quite worried about being robbed, assaulted, or their house being burgled. A much smaller proportion will actually experience that. 44% of participants thought that knife crime was a problem in Portsmouth. That's really similar to the last time we did the survey. And most people thought this because of things that they'd heard or seen in the media, or from people they know, rather than through personal experience. Reports of witnessing or experiencing knife crime have remained stable since 2020. So that's the first time we started asking questions about knife crime, with about 4% of our residents having witnessed knife crime and 1% having experienced knife crime. There is a bit of a caveat about that, because people who are potentially involved in knife crime may not want to engage with the survey. So these findings would hold true for most of our residents, but there may be a small group who are having a very different experience, so we need to bear that in mind. Levels of antisocial behaviour reported to the survey have been relatively stable, again since 2014, although been reducing very slightly since 2019-20, which obviously I've mentioned before, contrasts with the level of antisocial behaviour reported to the police. The types of antisocial behaviour currently causing the biggest problem for our residents are people using and supplying drugs, traffic issues and people hanging around, and that's quite similar to previous surveys, but traffic issues have been increasing. We also asked people about where they feel unsafe. Just over half of participants said there were areas in Portsmouth where they felt safe or avoided if they could, and we asked people where. And the chart that you see there is basically the ranking over the last 20 years of where people said they felt most unsafe. And we've colour-coded it so you can sort of quite easily track, hopefully, the different areas and what's happening. You can see that Somers Town and Buckland have consistently really been areas where people are fearful. But you can also see that some areas have become more positively perceived, such as Portsea and Paulsgrove, and other areas such as Commercial Road and Fratton and even Southsea as well have become more negatively perceived over time. And what's really important this time is that for the first time since we've been doing this survey, Commercial Road and the city centre is now the area that is the area people feel most unsafe or would avoid if they could in Portsmouth. And then we've also asked people why. Why do you feel unsafe? The main reasons given for avoiding Commercial Road city centre were groups hanging around, alcohol-related ASB, drug use and dealing, and homeless people. Now, this is really different from the reasons given for Somers Town and Buckland, which were largely reputational. Most people who said they avoided Buckland and Somers Town, it was about the fact that they heard it had a bad reputation. And that even included people that lived in those areas as well. That did, next one. And we did also ask, people what would help them feel safer in those areas, and particularly broke that down by gender as well, so that we could feed into the violence against women and girls strategy. The places that women avoided were the same as for men, but greater proportions of women felt unsafe. And responses about how they could feel safer, increasing police presence is always a really top response, as in improving lighting and CCTV. Tackling drug use was really up there, and more activities and provision for young people. And what's really interesting, the first time it's come out as a common theme, is around regeneration and environmental improvements, which are heavily linked to the Commercial Road city centre area, which we didn't see before, when the most feared and avoided areas were Somers Town and Buckland. Okay. The whole survey, if anyone's interested to have a read of the whole document, it's available already on the Safe Portsmouth Partnership website. And also, once we get the serious violence strategic needs assessment that Matt was talking about earlier, and we put that into the strategic assessment, we will also put that on the Safer Portsmouth Partnership website for anybody. If anybody has any questions?
Thank you very much. I'm quite interested in the people hanging around. Are they young groups of teenagers and things that are hanging around? Is that why they've said we'd like more things for young people, because it is the groups of teenagers that they're fearful of? Or
it isn't just young people. It was when I was looking at the sort of detail, because we do ask our supervisors to probe people and ask more questions and take some of the detail down. It was homeless people hanging around as well. It was groups of people hanging around, making people feel a bit intimidated, not just young people.
any other comments or questions? Yeah.
Thanks, Linda. I think we need to be very careful when we use the term homeless people, because a lot of these people are not homeless. It's a myth. The perception is that they are homeless, but actually they are often people who are placing themselves on the street in order to carry out acts of criminality. So we've had this raised at full council before, and we challenged it then, and I'm going to challenge it now. We've got an excellent service and brilliant outreach to help genuinely homeless people, but when there have been investigations into some of the people, I'm not going to name anybody, but it's been reported quite extensively in the press that some of the people down there have actually been arrested by the police because they do have somewhere to live. They are begging professionally, and they are also involved in various acts of criminality. By no means everyone, of course, but we shouldn't generalise and say that homelessness or homeless people are a reason to be fearful. They are not generally. So I just urge that word of caution in how we use our language.
Yeah, I'm really sorry. When I'm sort of talking about this, I'm using the words that residents use when they speak to us, and so you know, I do take on board your point, but I think there's a very strong perception from residents that it is homeless people, and maybe there's some work that needs to be carried out actually to try and change that perception for our residents as well.
Thank you. Any other comments or questions? No? So we'll move on to the next one, which is actually very much linked, isn't it? Violence Against Women and Girls Strategy. Caroline.
Thank you. I've come back with a shorter report because you'll remember that I came just before the summer holidays with a very long one, providing a detailed update of all the work that we've been doing to engage with stakeholders across the city to develop the city's first violence against women and girls strategy. So I won't go back over that, and I'm sure that you've all had an opportunity to read it, but I am asking for a decision today. I'm asking for members of the Health and Wellbeing Board to approve this strategy, pending some further informal consultation. It's going to the Domestic Abuse Strategy Group next week, for example. But what we really would like to do is to commit this to some action now and to start to move forward with some of those key themes that have been considered within this, and actually some work is already starting on those. So it's timely that we do move forward, and particularly that we sit here today less than a week before the International Day for the Elimination of Violence Against Women and Girls on the 25th of November, which we know locally as White Ribbon Day, and the 16 days of action that follow this. It feels incredibly timely to be sat here today talking about this. And actually, I'd like to take an opportunity to say thank you to the literally hundreds of people who have been involved in the development of this strategy over the last 18 months. It is a considered piece of work. Over 800 members of the public engaged in our sexual violence, harassment and abuse survey, and it was absolutely heart-wrenching, to be honest, to read some of the feedback they provided, giving us a steer on what we need to do to address some of these behaviours and crimes that are preventing everybody in Portsmouth from being at their best. In terms of what's changed since the report, some of you will be aware that Portsmouth Abuse and Rape Counselling Service formally announced its closure today. It will, after 40 years of delivering in the city, be closing on the 31st of March 2025, and I think that whilst there are alternative provisions available, it is a sad day for us and for the city that we're losing one of our services that has been at the cutting edge of championing change around violence against women and girls over the past decades, with campaigns like Shrink the Elephant, exposing and calling us to talk about the stigma around sexual violence, for their work to support us to have over 30 venues in the city trained to respond to sexual violence through the We Stand Together programme, and for the countless other work they've done and all of the victims of violence they have supported. Unfortunately, it does reflect, and is reflected in this strategy, an ongoing austere landscape in terms of addressing violence against women and girls. We're rolling towards the end of our Safer Streets 5 programme. We have no announcement from the government, apart from some national wording around a commitment to violence against women and girls, about where the next tranche of funding will come from to help us to realise our visions. That means that this strategy has focused very much on what we can do within our existing resources to make a difference, because we cannot rely on new pockets of money dropping down at us. That said, you know, we can do things, and we are doing things. So actually, we annually run a campaign called Is This Is Love? It has been running for a number of years. It's been very successful, but we're going to use this strategy as an opportunity to review and reflect on that and look at our language in that campaign and how we're targeting it to move forward and in alignment with our early intervention and prevention pillar within this strategy. We have worked in partnership with Hampshire Constabulary to begin to develop a MARIC strategy group. This builds upon the operational and person-centred planning that already takes place in the city and the operational group that already reviews that work, to take lessons learned into a more strategic space. So, and it mirrors work going on across the rest of the county, and will be aligned to the governance structure for this. And on the 25th of November, in alignment with White Ribbon Day, we'll be launching the Safer Together Hub. This will be a pan-Hampshire hub that Portsmouth have led work on behalf of the Office Police Crime Commissioner, in order to put into one place, a one-stop shop for information associated with all of the crimes and issues that are covered under this strategy. So I think that is all I have to say, but I'm happy to take questions.
Any comments or questions? Councillor Horton.
Thank you. I wrote some notes, but Caroline's basically covered it all. But I just wanted to echo some of the points that you made, because I think it is, particularly around the parks closure, is a really, really sad time and indicative of a wider issue. So obviously I want to place on record thanks to them. Interestingly, when I first became a councillor, that was one of the first visits I did. And I made a point of going to see them, not just because they were in my ward, but also because I'd been involved in the rape crisis line in Lancaster in 1980-something. So I had some very interesting conversations with them about it. But I do think it's worth raising the fact that they have tried everything, and the council has also tried to help keep them alive, because we value them so much, and this is indicative of a decline in resources across the piece. I am well versed at saying things are a complex matrix, but actually these are people who are in crisis, and we are conscious, but we also need to keep boxing clever about how we can intervene at earlier stages. We do commission services, and they honestly, Parks ran some brilliant services for us, particularly with young people. And we'll still carry on commissioning services, but it's a really sad state of affairs when we know what we need to do, but we're all scrambling around for the same resources, and that could be applied to most of the agenda items today. But I wouldn't be doing my job if I didn't mention schools, because in actual fact, it's the attitudes, the values, and the way we set young people off in life and what's actually important, and we can do a lot of work around there in the prevention agenda. And I know that Caroline's done a lot of work on that, and we've got some plans for rolling out stuff in schools around attitudes to not just girls, but the way that we treat each other. And I'm sure that we can bring some of that information back here at a later date. But in the meantime, at this kind of really harsh end of it, thanks to Parks for everything they've done, but also thanks to all the other organisations who step up and are part of this complex kind of landscape. It's a sad state of affairs when this still needs to be a top priority, but everyone in this room needs to be part of the answer for this city.
Thank you very much. Councillor Heaney.
Yeah, thank you. I just wanted to follow up on what's just been said about the schools issue. I was noting page 12 where it says that opinion and attitudes, and how we don't really know, because we don't get data about what goes on within schools. I mean, I was a school governor at a primary school until about 5 years ago, and I know the school took put a lot of effort into making sure that there was respectful behaviour between each other and so on. And it seems that possibly something goes wrong when we get to the secondary stage, and maybe it's not to do with what the schools do, but the attitudes and the sort of things that young people pick up from outside sources, and essentially from the social media and things like this, and how we combat that. And I don't know if it's true to say that at primary school there's a lot of effort, and I think probably quite successfully, only in the experience of my school I can talk about that we don't have big issues. But is there something that tends to change at secondary level because of this wider environment that kids go into, and it undermines the efforts to sort of that schools do to try and get people to behave respectfully towards each other? And I haven't got an answer to that, but I'm just wondering if that's one of the issues we're going to have to tackle.
Caroline.
Just to reassure you that in creating this strategy, we've actually worked with children of all ages using a tool called What Jars You, which was developed by the Welsh Government and put in the Agenda Toolkit, which is a fantastic resource for supporting anyone working with children to address tricky issues. I have personally delivered that workshop to children as young as 9 years old, and I'm very sad to say that those children put in their jars worries about sexual discrimination, racism and bullying. And this is, in spite of all the good work that our schools across Portsmouth do, we need to do more to challenge those behaviours, to challenge when girls are told they cannot play football by boys in the playground on their primary school, to challenge those behaviours when girls are told that they cannot like colours other than pink and purple by boys in the playground in their primary schools, to challenge those behaviours when boys are told they can, by other boys they cannot dance in primary school. Yeah. So these are, as well as doing work to address those behaviours and values holistically in an ecological model, we do have more to do.
Yeah, just to reiterate what Caroline has said, I mean, the schools across the city are actually doing an extraordinary job actually to address this issue. We provide quite a lot of support and resources which they are using. We know we want to do more, and we're talking with Caroline and others about how we do that. But yeah, the efforts from head teachers and the staff involved is quite extraordinary. But Councillor Heaney's right, you know, in terms of social media, that does undermine a lot of the work we do. But it is what it is, and we are trying to do all we can to support our schools to address this. But there's a lot of good work going on in the city.
Councillor Pitt.
Thanks, Linda. I just wanted to roll back slightly to something that Caroline mentioned earlier on, and that was about the crisis in funding for the VCSE around this particular issue. There absolutely is, and Parks have actually identified some of the cliff edge funding that's falling away in March 2025 as part of the reason why they know that they just can't carry on. But this is not just an issue facing this sector, it's facing the entire VCSE. And it is an existential crisis because the council is also under pressure over our own resources, and if the VCSE collapses, we're going to have some really big issues that we're going to need to deal with. Now, we know from the report work that the Hive did around the state of the sector a little while ago that there were a number of key organisations in the city who were flagging the fact that they were really struggling around financially, and the increase in wage costs and NI costs that have come through the recent budget are a massive threat to the whole of the VCSE. And it's something we should all be very aware of moving forward, because that is a real problem, and many of these organisations help in partnership with the council to deliver some key services that are vital to local residents, and it's not a space the council can just step into and backfill. We don't have the resources to do that, and we are seeing some key organisations really under a lot of pressure, so it's something we should all be aware of.
Thank you. Lorna?
Yeah, thank you. I just wanted to echo that really, that it is very, very difficult in the sector at the moment. We have, in our latest report for the state of the sector, noted that 47% of our organisations are actually using reserves to fulfil their operational needs at the moment. So that is just getting by, and that isn't sustainable. And we're also seeing a landscape where a lot of grant funders are closing early, closing down. So actually it's very, very challenging out there, and it's very, very difficult for everybody in the city, and it will only have the impact on our residents.
Thank you. Andy?
I suppose it's a comment more than anything else. I think every time we publish this type of document, every time we reflect on what's happening in our society, it's a bit similar to the informal carers agenda. People in our city who work for our organisations will be experiencing this in equal measure. They are our citizens, they are our residents, but they're also our employees. And I guess there's some stuff that doesn't feel necessarily to be massively active in this space, but I think it's still really important, and I think sharing these type of documents, sharing these type of summaries, communicating as widely as we can within our workforces about these but also the way that we model our behaviour, the way that we work with our staff is the way that we want them to work with our residents. Having that level of empathy, having that level of understanding, and understanding that sometimes when people are having difficult days at work, it's not related to the work, it's related to what's going on for them in their personal lives. I suppose I speak from a little bit of personal experience that we had a couple of years ago in our workplace where we called out behaviour that wasn't directly violence against women and girls, but it was leading to it, it was enabling it, it was supporting it, I would suggest, and calling that out very publicly, saying sorry to our workforce that it had happened in our workplace, and being quite brave about, you know, saying that we weren't going to tolerate that and giving people mechanisms to identify if that was happening for them and to support them with that. So I just think between us all, we employ a huge amount of folk. Our residents are our staff, and our staff are our residents. And I just think there's quite a lot that we can do, even in small ways, both to call this out, but also to show that we won't tolerate it. Thank you.
Thank you. Lovely. Thank you very much. So are we happy to approve the recommendation, which is to approve the Violence Against Women and Girls strategy pending an informal consultation? Yeah? Lovely. Thank you very much. And then we move over to Mike for our attainment paper.
Okay, thank you. Right, what I'd like to do is run through the provisional results for 2024 in terms of attainment. I will also pick up on school attendance as well and some post-16 figures. Just to let you know, these are provisional results, although we're not expecting them to change too much. We don't get the validated results until early in the new year, so there will be a little bit of a change, but I'll comment on that as I go through the presentation. Just some headlines to start with. What you'll see as we go through this are what I would refer to as small improvements, green shoots across all the performance measures that I'm going to run through. And I guess, pleasingly, a slight narrowing of the gap between ourselves and the national averages. School standards remains an absolute fundamental top priority for the city. It's something we've been battling with for many years because we've been in that bottom sort of 5 to 10% across most measures in terms of how we compare with other local authorities. We've had this kind of paradox where the majority of our schools are judged by Ofsted to be good or better. I say judged by Ofsted to be good or better, bearing in mind we've now changed the parameters around that, so that single word judgment now no longer exists in terms of future inspections. But if you just look back to what that was in September, we had over 85% of our schools judged good or better, which is slightly above the sort of national average. But when we look at our performance measures, we are well below the national average. So that's the kind of paradox we've been talking about, and I'll come on to something called the big conversation around education and how we are looking at that. So if I just give a bit of context first, though, before I go through the results. Some of you will be familiar with this, but just a bit of background to education across the city. So we've got 61 state-funded schools and approximately 27,000 pupils in those schools. Unlike many other local authorities, the majority of the schools in the city are part of a multi-academy trust. We've got 14 multi-academy trusts responsible for 44 academies across the city, and we have 17 LA-maintained schools who we support, and we kind of act like a multi-academy trust in terms of a local authority working with those schools. And to complete the picture, we've got 4 independent schools, 1 GFE college, which was 2 colleges, the Portsmouth College and Highbury College, which merged in 2021, the university, of course, and we have 100 or so early years settings across the city. Overseeing this, we have the Portsmouth Education Partnership, which is a really strong partnership set up back in 2016. All of our schools, all of our multi-academy trusts and all the sort of key partners you'd expect to see involved in education are on that partnership and on the board. And we have a range of priorities which sit underneath that board. I'm not going to go through all of them, but I think the important thing to note is that for the majority of those priorities, they're led by a school leader or a MAT leader This strategy is very much a schools-driven strategy, which I think is really important in terms of buy-in and impact. Another bit of context, a couple of years ago we were named as a priority education investment area, which was uncomfortable to one degree in that the spotlight was on us because of our attainment issues, and the government were prepared to invest in the city, which was the sort of silver lining with this, the fact we were getting some additional funding and some prioritisation around other initiatives that the government was supporting. Part of that was a local needs fund of 1.8 million, and we put together a delivery plan for that with key priorities around literacy, maths, digital learning and school attendance, and a focus on some of our underperforming cohorts of children, such as SEND, special education needs, and also our disadvantaged children. The PET board has taken on those responsibilities, so the DFE would normally expect you to set up a local partnership board to oversee that work. Well, we already had the mechanics, the structures in place, so we simply went with that, and the DFE were really happy to do that. And we're up and running fairly quickly. It was only a 2-year programme, I say was, we're still in it at the moment. Year 2 will end in March 25, but there has been extremely good engagement. We're starting to see impact, and I think these green shoots we're seeing are part of that. At the same time as doing this, we've had a big conversation, which is still running, to look at that sort of paradox I talked about, to say, you know, why is attainment as low as it is? What are the factors? We've looked at a range of hypotheses and have been testing those out in the steering group and with our colleagues and schools, head teachers and so forth. We're now sort of getting towards the end of this conversation, and we're now focusing on a number of key areas that we're having a look at in a bit more detail. One is around leadership and culture, early language, so looking at our early years sector and how that then impacts on schools and early language within that. Funding, you won't be surprised to see. The increasing complexity of our special education needs in the city, and particularly around social, emotional and mental health issues, which is impacting on schools. Teacher recruitment and retention, and also effective transition across our key stages. We have a lot of transition points across our city, and we are seeing dips in performance as children move through those transition points. So how can we impact on that? So that's an ongoing conversation, and I'm sure I'll come back to this meeting to give you an update on that. So what I'll do now is just go into a brief summary of the measures. So if I start with phonics, which is something we check in year 1, in key stage 1. And you'll see there, and by the way, I've shown figures pre-pandemic and then post-pandemic, and what you'll see in all of these figures is a gradual return to where we were used to be before the pandemic, and this is a national issue. So phonics is a good example of that. We have seen increases there over the past couple of years, so we're at 76% in terms of meeting the expected standard. There isn't much change in terms of our gap between ourselves and national. That remains the same, but at least we have kept at pace with the national improvements. We have seen those too in Portsmouth. Just for your information, if you can't see it, blue is obviously Portsmouth, green is our statistical neighbours, that's the average for our stat neighbours, and red is national average figures. We then come on to the end of Key Stage 2, and this is the figure, the combined figure for reading, writing and maths at expected standard, and there you will see again a small increase in Portsmouth. The gap has narrowed between ourselves and national, 2 percentage points narrowing of the gap. Still not where we want it to be, but we are making progress, which is pleasing to see. If I just break that down, so if we go into reading next, again we've seen a small increase for reading, and the gap there between ourselves and national, and our stat neighbours indeed, has narrowed. If we go on to writing, which is a key concern, and we've seen significant dips since the pandemic, and that's been a national issue. No major progress has been made in terms of writing. We're still where we were last year, and that has been the case nationally, so the gap is still the same. We are putting a lot of effort into writing. We have a fairly small school improvement team, but writing is top of their list of priorities, working not just with our LA maintained schools, but also across all schools, and we have funding from the Priority Education Investment Area to support that work. And in terms of maths, we have seen a small increase there, which is good to see, and a very small narrowing of the gap also. If I just come on to GCSE results, I don't have too much to show at the moment. The DFE would normally by now have published, or at least have the provisional results published, where we could see our comparisons with national and our stat neighbours. There has been a delay this year. We're not expecting those figures to come out until late November, early December. So all I can give you here are the results that we collated from our schools when they came out in August. But I'm not expecting these to change significantly. I think these are, quite a pleasing set of results in some ways, because we have seen significant improvements across all those measures in terms of English and maths, which is the sort of area we look at when we collate those results during the summer. The standard pass in English and maths, so that's grade 4 and above, we've seen a significant increase there from 52 to 55%. Nationally, there's been a small improvement, but fairly small. We've closed that gap with national, so that was pleasing to see. But yeah, as I say, I don't have any further results to show you at this point in time. Also, and we're still waiting for these don't come out till March, it's worth just looking at the level 2 and level 3 results by the age 19, so looking ahead post 16. Level 2, that's 5 GCSEs or more, doesn't necessarily have to include English and maths, and there you can see significant climbs since 21-22, so these are 22-23 figures, which I know feel a little bit out of date. So we have climbed that, we've closed the gap slightly. Different story for level 3, so this is equivalent to 2 A-levels or more. Nationally, that has dropped across the country. You can see that also for our statistical neighbours, and the same drop for us. Now, we're hoping to see that turn around, and the figures that will be published in March for 23-24, we're expecting some improvement there. So once they're available, I'll make sure those are circulated. What I'd like to come on to next is attendance, school attendance, and this is probably one of the biggest factors in terms of attainment. We know if we look at our results for those who are regular attenders, so above, say, 96-97%, the results, you won't be surprised to hear, are relatively good for those children. Where it's below that figure, and particularly where it's below 90%, so what we refer to as persistent absence, or indeed below 50% severely absent, the figures are, not surprisingly, much poorer. So school attendance, if we can improve that, get that right, we know that will have a positive effect on attainment. I've got here the published results where we can provide comparisons, so that's 22-23. I will give you just some updated figures for 24 in terms of what we collate. But if we start with the overall absence rate, you can see there fairly high, so over 8% of children absent from school across the school year, and that is above national and our stat neighbours. The latest figures, pleased to say, we've seen significant improvements, so we're now at 6% overall, which is a much better picture. And if we go on to primary, there you can see we have figures at just around about 6%. Again, if we look at the latest figures in terms of what we collate, we're around about 4.5% primary, which is a significant improvement, and in fact that's better than the national in terms of what we're hearing. Secondary, I seem to be missing a slide here, so I don't have the secondary figures for you, but in 22-23 we are around about 10.6% absence overall. The English average was around 9%. Secondary is around about 8.5% at the moment in terms of autumn term 24, which is not where we want it to be. So the improvements we've seen in primary we haven't yet seen that significant step change in secondary. And we also are concerned about levels of suspensions in secondary, so much more work to do there. But as I say, that's a key priority for us, and we're hoping the investment we've put in over the last 2 years and the work that secondary schools are doing will pay dividends in future results. The other figure I want to share with you, which is of real concern, is post-16 participation. So these are what we refer to as NEAT figures, so not in education, employment or training. We had made significant gains over recent years, but we have now seen those figures start to climb. A variety of factors behind that, attainment being one of those. The overall figure for 23-24, this is a figure that's collected between November and January, and that's the figure that we then compare ourselves against national and our stat neighbours. We were up to 7%, which is a real concern. That's a significant growth from 22-23. The latest figures, I can tell you, have come down slightly, which is good news. And if we just break that down, I think I've got the figures here. These are just the neat figures, so these don't include children who we don't know about. That's 5%, and those children that we are unknown, so we don't actually know whether they're in education, employment or training, or whether they're not, is 2%. And again, that figure's come down as well, which is good to know. We do track all our 16-year-old and 18-year-olds, and those children who are NEETs or who are at risk of becoming NEETs. We have careers and progression advisors that work with those to try and get them back into education, employment or training. Okay, that takes me through all of the results. Happy to take any questions.
Thank you. Any comments or questions? Councillor Horton?
You knew. Thank you, Mike, and also thank you to everyone, all the officers who work so hard in this area. I just want to unpack something around standards. I'm going to go on to a bit of a soapbox. When I started teaching many years ago, my head teacher said to me, Susie, it's not your right to roll out your philosophy of education on your own path. You have to do the best by the kids within the system that you've got. And I've always maintained that. So I've tried to work in the system, which has become increasingly narrow, in my opinion, because I started teaching around the national curriculum days, but bring my philosophy of education, which effectively is child-centred. And I'm sure this is the forum where that is going to, I'm going to be in good company. So just the thing about standards, that is the tool by which we're measured, along with Ofsted. And as Mike has highlighted, we have good Ofsted results. And actually, that makes me feel happy, because Ofsted look at more than results. So I think we're in a good place in the city. But there's this weird thing around standards. And that's the measurement we want. We want it for two reasons. We want it because we want the good stuff around the local authority to be known, and we want that reflected in a positive way, but also we want our kids to have qualifications so that it can open doors. But my view, and this is my soapbox thing, is there's different ways of getting from A to B. And sometimes, I think, over the last decades, there's been a more direct route. So you do more maths. If you want better maths results, you do more English. If you do, and we actually know, in this room that we know, that that's not the case. If you're going into school or not going into school because you have trauma, if you're going into school or you're not going into school because you're being abused or you're scared of other people in your class, if you're unhealthy, if you're unhappy, then your chances of doing well in maths and English, which are the main measurement that we have, are going to be diminished. And we know that not all children are interested in the same thing. So the breadth of curriculum is really important, and we do a lot of that in our schools. And I'm cautiously optimistic about the new mood music that's coming out around the curriculum. But it is about culture, it is about music, it is about trips and experiences, it is about having autonomy within your own school that's going to make you more likely to want to go to school and then achieve in school. Mike mentioned, and the money from the PEIA, the Priority Education, has been used really wisely within very narrow kind of sort of dimensions. But also the other thing that I want to raise is the work that we're doing across the city around relational practice and going towards the previous update that we had about the restorative conference. This is a city that's really embracing it in lots of areas, and it takes time to change these cultures, but we are seeing some phenomenal results within our schools, and I think that's worth highlighting, because it is the relationships. I saw my godchild last night, and their favourite subject link is always diametrically linked with their favourite teacher. So that we know that the relationships are really important. So I just wanted to sort of jump in and say, actually, everyone in this room is working towards the same aim, which is actually having well-rounded people who are achieving and becoming the best versions of themselves by being healthy, mentally healthy, physically healthy, but also feeling safe. And then that's when they flourish. And that's when they want to go to school. And that's when the attendance will go up. And then I'm cautiously optimistic that our results will follow. But you cannot start with just a dead straight line from A to B in the results. And we don't do that here. We work collaboratively across many, many partnerships to make that happen. Thank you for indulging me for my soapbox.
No, thank you. And from my perspective as a GP, I'm seeing a lot of children, and particularly parents, concerned about children's social, emotional, mental health, not going to school, obviously getting into trouble for not getting them to school, parents tearing their hair out. And it is a very difficult stance, and obviously my job is to try and encourage them to work with the schools to see what they can do to assist. We've got mental health teams in schools and all of that. But health definitely has a part, doesn't it? We have long waiting lists for assessment for neurodiversity and things, which we obviously are trying to change in the city, but that all takes time, doesn't it, to embed? And so, yeah, it would definitely has to be a partnership, doesn't it, I think? Questions? No? Thank you very much. Public health, annual report. Helen.
Thank you, Chair. So I just really want to pass over to Dominic Latouche, who's the Assistant Director of Public Health, who has led on this year's developing this year's annual public health report. And I'd like to thank her for all the work that she's done with colleagues to get us to this stage where we are publishing the report. What you're seeing today is obviously the executive summary, and we're also going to show you a film. But you will get the full annual public health report in quite a short time. But we just really wanted to use this as an opportunity today. So I'm going to thank Dominique and pass over to her.
Thanks, Ellen. Yeah, and absolutely thanks to the whole team that's put this together. It's been a big piece of work. So this year's report looks at health and sustainability and resilience in Portsmouth. And as Helen said, we're looking at the executive summary today that's in your packs and on the website. Climate change is one of the greatest threats to our health that affects us, is starting to affect us now and will continue to affect us into the future. And this report really highlights the importance of the environment to our mental and physical health, and the way that climate change is already actually impacting on our residents, and how our city is responding to that challenge. And in particular, it focuses on extreme heat, on flooding, on air pollution, and on insect or vector-borne diseases, which has been in the press today. So I'll show you an infographic here, which should work. No, because I need to plug myself in. Thank you. Thank you. I think it's this one. Practiced this beforehand, but obviously it hasn't quite worked, so you should be seeing that any minute now. So this was put together by our graphic design team. This really highlights some of these the key challenges that we're experiencing. I've just talked about. We know that 1 in 20 adult deaths in the city are linked to long-term exposure to air pollution. We also know from the UK Health Security Agency that over half of our population is highly vulnerable to the effects of air pollution. And we know that we are likely to experience flood risk without defences, but even with our increased defences, there's still a degree of flood risk in the city that's there. We also know that our changing climate in the southeast is suitable for insect-borne diseases, particularly mosquitoes, tiger mosquitoes that can carry dengue, chikungunya and Zika virus. And so we monitor for those at the port. It couldn't really be more timely talking about this topic. This week we've got the COP29 summit taking place in Baku in Azerbaijan. And this week Councillor Pitt put together a blog that's on the website outlining all of the work that we are doing in the city to discuss and address the coastal defences, increasing biodiversity, improving air quality, addressing waste and reducing carbon emissions. And our climate and change and greening cabinet member Kimberly Barrett has also put together a video on the website on that issue. So it's a very live topic that we're addressing here at the moment. In 2019, the Council declared a climate emergency, and since then we've seen more and more the impacts that this is having on our city. And this Public Health Annual Report really gives a number of case studies of how those 4 issues, flooding, air pollution, extreme heat, and threat of infectious disease through insects, are affecting people of all ages and services in Portsmouth. And in a minute I'll show you a video, as Helen said, of how that's being addressed in one of our local primary schools. There are co-benefits from addressing climate change for health, obviously, but also for planetary health. And the plan on a page that's in your pack that I'll show you here really looks at those co-benefits and how we can maximise that. So if you take, for example, an initiative to address flooding through perhaps greening or rain gardens, that will not only improve flooding but would also increase biodiversity. It would provide shelter for extreme heat and actually might increase and encourage people to walk and cycle because the environment's more pleasant. So there are many co-benefits for addressing this issue. And we sometimes call those sort of no regrets solutions, things that can benefit health and society, the local economy, and local ecosystems as well. So we really need to act now. Now is the time to do this, and this is a sort of call to action in the executive summary and also in the full report. We can ramp up our adaptation response, I think, and better coordinate existing interventions between organisations and communities, particularly for those at greatest risk, who we know to be the youngest and the oldest and those with existing health conditions in our city. And this report really gives hope that we can do that we can fulfil our city vision for a green and healthy city. So I'd like to show you a video now from children at the Eco Club at Arundel Court School, talking about flooding and their experiences in their own words.
Do the school's ground ever get flooded?
Well, yes, but they basically only get flooded on mainly on the field and just outside of school.
The school grounds does get flooded, and like Ethan said, it's mainly on the field and then outside of the school. On a rainy day, what happens?
The entire side of the field and outside the school start flooding from rain, and it can get quite out of control.
So on a rainy day, outside the school gets flooded, so then you start the day with wet feet, and then the side of the field gets flooded, and then there's one corner where all the water goes to, and then the day just gets wetter as you go on. How do you feel about when it floods?
feels quite sad because when it floods, it can basically erode away all the soil on the field, making it harder for the grass to stay put, but it's also making the side of the field that gets flooded stay green even when it's a very hot day.
It's quite annoying because when the school grounds flood, we end up not being allowed to go in certain areas of the playground at plays and lunch. What are the plans to stop the flooding?
Well, our eco club is they're gonna start making like a swale so that all the water gets seeped through the rocks and then plants can grow inside the swale.
So, Eco Club have been thinking of ways to stop the flooding, and down the side of the field where it floods quite a lot, we're going to make a swale with like stones, and we're going to put plants that can survive in really wet conditions. So, what do you think about the school playground flooding?
Well, I don't like it because everyone comes in wet, which means that everyone starts the day a bit miserable, moaning, Miss Miller, I've got wet socks, my shoes are flooded, what do I do? And then, if I'm being kind, everyone takes their socks off, sometimes we have to wring them out, they get put on the radiator, then the classroom smells, and it's disgusting. Or if I'm not in a good mood, then everyone has wet socks, which means that no one's really learning because everyone's thinking about the fact that they've got wet socks. Do you think that's right? It's hard to learn when you've got wet feet, isn't it?
Yes. Are you guys going to do anything to stop the flooding?
Yes, so quite a few years ago we had some experts come into the school field, one from the University of Portsmouth, one from, I can't remember the name of the charity, and they came and they looked at water on the playground, and they said, well, actually, what we need to do, rather than trying to stop the water, which we can't do because we can't stop the rain, we need to think about how we use the water and how we channel the water. So now that we've got these amazing plans in place, one of the things, because we thought about putting trees all over the field, but then we wouldn't have a field. So then we're like, ooh, what could we do next? So we thought about putting trees all around the edge, but then the air ambulance uses the field for a landing spot. So we were like, well, we can't do that because we need a helicopter land. So then we came up with the idea of making a swale, sometimes called a rain garden, that will run down the edge of the field, because that will also create a new habitat for moisture-loving plants, maybe some more insects, hopefully some dragonflies, and we'll see what different, so we'll create a totally new habitat, which will also, instead of the water then just running into the drains, which then might just go into the sea if the sewage systems get overloaded, it'll then drain slowly through the soil and create less puddles, hopefully. That's the plan.
Thank you very much.
Thank you. And thanks from ourselves. Should go back to Arundel Court School for a lovely video. Really educational. Who has got any questions or comments? Councillor Winnington?
Thank you. Thank you. You could tell this one was coming as well. Our annual reports for public health are always a bit different. And this is yet another one of our different reports. And a really important one because it really is holistic in what it's looking at, in looking at how we work in our environments and how, and as Dominic really well pointed out from the one sheet, which as said is in your packs, about the way that things connect in with everything else. And that's a really important part of this, that if we tackle flooding, it doesn't just affect flooding, it affects environments in general. If we tackle air pollution, it also helps us with those other aspects as well. But also the challenges we've got. So when I had the presentation of this, including that amazing video from Arundel Court, and thank you so much. I say I got into trouble a few years ago with the news. It's a shame they're not here actually today, but if they're watching, when I said, when we were first doing the Super Zone work, which was years ago now, and pre-pandemic, it's one of those things. And I said, from the mouth of babes. Well, actually, I stick by that, because actually children, they are our future, and what they say and their perspectives on things are massively important. And we've been looking at attainment just now, and then we're hearing from them about what aspects are there, and they're dealing with practical reality of flooding and trying to sort that out. So having videos from them, and I know for the other topics from the public health report, we've got videos from other organisations, 3 more videos, but that's the one there where we've got our children sort of saying, being practical, but also about the reality of, if we don't sort these kind of things, then there are consequences. And therefore our children, and they are our future, they are the ones who are going to have to deal with the consequences of things, which is exactly the kind of things were in the report. But so going back to so some of the things that we do, though, have challenges of their own. So Don was mentioning about mosquitoes, and as we were talking when I had this presentation, I said, well, one of the things we do to increase our biodiversity in the city is we cut down on our mowing. So we have our nice sort of meadows and everything, and that encourages biodiversity and wildlife. However, that also creates an environment whereby that might be better environment for mosquitoes. So the work that we do at the ports to monitor for those mosquitoes, which might be disease-carrying mosquitoes, is really, really important. It makes a real. It's about how all those things link together, and also it's about. And we were talking about things like ticks and other things that insect-borne diseases, that we just have to be cognizant about, thinking about how we live in a world where we've got climate change going on, and we've got our environment is changing, getting warmer. Therefore, you've got more challenges about that, about how we do our public health messages, and indeed our practical messages, to make sure that people are protected. But this report is exactly about that. It is about the challenges we have, the things we can practically do, but also how everything links in with everything else. And so I'd like to thank Helen and Dom and Matt and the rest of the team who've been involved with this. It is something that we do, I think, better than just about anywhere else, because we work across the council, we work with our partners, and we look at things in a really holistic way, which is noticed. It is noticed. A lot of other public health annual reports are very traditional. They tackle things in a very in quite an unimaginative way, but this really fits in, not just with all the things we do across the council and beyond, but also with our city vision, and what we want to do in the future, and what our populace say are important to them. And that's a really important part. So thank you for the report, and I really recommend it to the Health and Wellbeing Board and to the wider city as well.
Thank you. Councillor Heaney.
Yeah, thanks so much. I found it really interesting, and I'll be very interested to read the full report as well. Just to pick up on the issues about air pollution and climate, which obviously you focused on, they're really big problems, and it can seem almost impossible that we can really do anything to deal with it. But I actually think that example of the school was really interesting, because a lot of small solutions can actually add up to a big solution, and I think we should encourage people to do that, think about those things. Sometimes people dismiss these things. Oh, well, it doesn't really make you know, if I put a water butt in, it doesn't matter. Well, if thousands of people put water butts in, you've slowed the flow of water coming off our roofs and going into the streets and going into the sewage system and so on. So they can be really useful. So I think it's encouraging to say that, whilst the challenges are big, a lot of small steps could be really useful. I think the other thing we have to recognise is that to really tackle some of these ones is going to take some difficult decisions. We are going to have to make some difficult decisions. And the policy levers we use have to be thought about carefully, I think. we often think that, you know, charging people for doing things we don't like is a good way of dealing with it. But Michael Sandel, who you may have heard about, he talks a bit about this and says that actually maybe that just creates different incentives, that people who can afford to pay the charges for doing things we don't want to do just carry on doing it. But the people who struggle because they have other problems to deal with, you know, are penalised. So thinking about how you use these policy tools is going to be quite important. But I think, you know, we're going to have to think about that, and particularly in relation to our city, because our geographical shape makes it more difficult to deal with that. We're effectively a big funnel, you know, we're an island city and everything is concentrated, there's no dispersal, you know, so again it makes it more difficult. But I'm very pleased to see this raised, and I think we just need to encourage small things. I mean, one example I think about is when people are putting their driveways in, you know, I think you should be compelled to put permeable surfaces in, you know, it shouldn't be a choice, is it? No, because if you put hard surfaces, that creates extra problems. And so there are all sorts of things that people can do, and if they think about it, and it doesn't have to be hugely expensive because everyone has to do it, I'm sure the price will drop. So anyway, that's a few random thoughts about the wider thing.
Thank you. Thank you, Tom. Anything else?
Just to respond to that, I couldn't agree more, because I think that those big solutions are essential, and that's what COP29 is discussing, and at a city-wide level we're discussing those as well. But those small changes that that residents can make, that we can support with, is essential. Sustainable urban drainage systems, de-paving of front gardens is mentioned in the report, so you'll enjoy that.
Thank you. So we'll move on to our last item, and I believe, Lorna, you're going to introduce, so it's the City of Sanctuary Migrant Women.
Yes, thank you, Chair. I just wanted to take this opportunity to highlight to the board some of the work our colleagues in the VCSE are doing in addressing the issues of gender-based violence in the city, particularly timely, I think, in respect of us approving the strategy for the violence against women and girls today. But I think what it also does is really highlight the importance of working in partnership. So I'd like to hand over to Shamila from the City of Sanctuary and Miriam from Vista to introduce their report.
Good morning, thank you for having us. Okay, so Portsmouth City of Sanctuary is a local charity supporting refugees, asylum seekers and migrants within Portsmouth and the surrounding area. But today I'm going to talk about our Haven project, which supports women. So just to define migrant women, these are women who are either asylum seekers, refugees, undocumented. So we don't use the term illegal, we use the term undocumented. And I'll talk about a case study that defines that, because illegal, what it does is it pushes people away from coming forward, either to the police or if they present at A&E. So we use the term undocumented. We also, in this group, have women that may be here as students, international students, care worker visa, so basically anyone that needs a visa. So in 2022, I was approached to start a group. So the Madai Trust called me and I said, actually, I'd love to start this group based on my own experience as a migrant woman, having faced homelessness in the city and exploited. Although I wasn't sexually exploited, I was used for domestic servitude. So I've always had a passion to sort of shed a light on the nuances and difficulties women of colour face. And we partnered with Harbour Church, Spa 61 in Vista, and in a little while Miriam will talk about the work she does with women involved in sexual exploitation. And Haven, the numbers that you've seen in the report, it's not all the women we see at City of Sanctuary. So we've supported 250 women that through the Haven project. So women who have experienced FGM, female genital mutilation, forced marriage, domestic violence, sexual violence, women engaged in sex work in the city, and women who have experienced sexual trauma along the migration trail. So maybe they left their home country okay, and then along the way they've met people that have sexually abused them. So why migrant women? Well, we face multiple barriers. The first one, most obvious one, is fear of authority. So it's really difficult to come forward. Language is another issue women face. And lack of social support. So if you're no recourse to public funds, you may have this fear of children's services, or if you're facing homelessness, not being able to access a bed space because of your no recourse to public funds. So Haven was formed with the Madai Trust who work with survivors of trafficking. And what we found very quickly is women presenting within City of Sanctuary have multiple complexities and multiple needs. And although we're sort of, dare I say it, experts in the asylum process and working with Home Office and working with migrant help, we're not anti-trafficking. We're not an anti-trafficking agency. So when a female presents, what Haven does is give us the ability to share information very quickly and signpost a woman to get that multi-agency support. So she doesn't need to say her story repeatedly. We use very much a trauma-informed approach. And I'll just go through some of the numbers that we've seen throughout the last 2 years. So 44% of the migrant women we support have experienced domestic violence. And this is one of the areas I want to focus on in 2025 is working with ethnic groups and how do they define domestic violence? And because there are different nuances, if a bride price has been paid for you, does it increase domestic violence? What is your community saying if you leave the perpetrator? What is your family saying? Is your immigration status linked to this man? And what barriers are there in educating the wider community? 40% of the women we supported had poor mental health as a result of gender-based violence. 90%, which was really worrying, had experienced sexual violence. And 70% had experienced forced marriage. Interestingly, there's a very high number of Namibian women in the city, and a lot of them experienced sexual violence. Women engaged in sex work were 40% in the city that we had supported. And Nigerian women were the highest presented to us in terms of domestic violence and honor abuse, particularly students. And maybe if she's a dependent of a student, it's really hard for her to come forward because the visa is linked to that man. It's not always easy to have the option of removing the no recourse to public funds or initiating the domestic violence concession, because there are all these factors that may influence her from leaving the perpetrator. Eritrean women, again, interestingly, all identify as having FGM. So when we see a family or a female, even men, we do what we call a needs assessment, and we're able to ask questions. Have you experienced we do a needs assessment, and then we invite women to have a specific female needs assessment, where we're able to ask them if they've experienced FGM or whichever form of gender violence. And Eritrean, Somali, Sudanese women all have had FGM, but they won't engage further. So they'll say, I've been cut. They'll say, oh, Ms. Shimila, I'm bleeding and I have pain. I may have pain during intercourse or prolonged periods, but they're not willing to take it further. And I think more work can be done around mapping, so if we've got so many women and they've got a girl child in the city, how many girls are at risk? Or how can we engage these communities to understand FGM and stop FGM, as opposed to, having a knee-jerk reaction when something happens? No recourse to public funds impacts women, and what it does is it makes women remain with their perpetrators of violence, because it's really difficult to leave. Another barrier is the high immigration costs. So I think the NHS surcharge is close to 1,500 per year. So if you're applying for a 2-year visa, it's £3,000 before you even pay the application. So all of these issues impact women, including the asylum process, where women are, so if you switch from one visa or you're here as an asylum seeker, the asylum process is not always easy in terms of women accessing the NRM or being believed. You know, she has to tell her story to a charity worker, and then to her solicitor, and then to a lawyer, and then to a GP. And there's always this theme that they're not believed, that, you know, they've faced some form of violence. Sexual exploitation was high, with us seeing women from Albania, Namibia, Nigeria, and Miriam will talk around the sex work as well. Unfortunately, we had women who slept rough in the city because they didn't have access to public funds, and on average that was about 90 days of them sleeping outside. And Haven, for City of Sanctuary, is totally unfunded. It's just been running on a lot of passion and dedication, and anyone that will listen, I'm there. I'll talk forever about Haven. And actually it's led us to here to speak to you, which I didn't think would happen. And it helps us to advocate with councillors and leaders and the police and working collaboratively. So I'll end on a case study and then hand over to Miriam, of a lady who entered the UK. So she lived in Spain, and she kept having pregnancies that she couldn't keep. And her husband left her. And a Nigerian man in Spain said, I'll take you to the UK and you can work. And she thought, okay, perfect. So she entered the UK via Portsmouth Port. She didn't have a visa. And she entered the UK, and then she entered via ferry with this Nigerian man and three other women. And she was placed in a house on close to Fawcett Road for sexual exploitation. And she was there about 3 to 4 weeks. And one of the punters, she said to him, I just need to leave. And he said, I don't want to know anything. And he dropped her off at Commercial Road, just opposite KFC. And she stood there and she begged and she said, please help me. And she ended up meeting another man who took her in, and she's now living with him and she has a baby with him. She presented pregnant at A&E, and the nurse thought, I've seen a leaflet, City of Sanctuary, we'll call them, only for her to then tell us her story. And we thought, oh my goodness. She's left other women there, and because we take a very trauma-informed approach, we couldn't say to her, let's drive around Fratton to find the house. But what it did do is I was able to signpost her to the Madai Trust, and she accessed Haven, and she was supported by Miriam. So you can see that this multi-agency approach really works, and she's living and thriving in the city, and off the back of that, we were able to continuously work with Caroline Hopper. Portsmouth City Council have been amazing, and we've set up the task force at Portsmouth Port, because they were like, oh my goodness, this has happened. And I believe it's hidden harm. I believe how many other women are there in the city facing that. And we should just continue, whether there's funding or not. Let's disrupt the system to get the women coming forward to being safe, safeguarding women, safeguarding their pregnancies, safeguarding children, making the city safer for everyone, irregardless of immigration status. And Haven not only supports migrant women, it's all women in Portsmouth, including British women. So I'll hand over to Miriam. Thank you.
Thank you. Yes, so just to kind of fill in some gaps about Haven as a group. So as you said, it's a really thriving partnership between Portsmouth City of Sanctuary, the Madai Trust Moving On project, and Vista. I'll just give you a quick overview of what Vista does. So we set up in the city recognising that Portsmouth area had no specific specialised support for women affected by the sex industry. I used to work for a national charity, signposting women across the country, and just knew that Portsmouth didn't have anything, so we set it up. At the same time as we got together to set up Haven, what we do is we talk a lot, don't we, about trauma-informed, we talk about gender-based violence, we talk about person-centred. These are great headlines. What I like to do is to highlight what it means to drill down into what that actually looks like in people's lives. I love the comment about the little solutions grow to create bigger solutions, and so I suppose what we were able to offer with Vista, we go into the strip club in town, we go into all the massage parlours in town and up into Cosham and Havant. We've now grown into Gosport and the Isle of Wight. Wellbeing visits into those places on a regular basis, and we also connect with women who are involved in the sex industry in a variety of ways. It's a broad spectrum. I could talk about that all day. You haven't got time for that. But particularly picking up where women are disclosing exploitation. So that's why our work with City of Sanctuary is really key, because, of course, what City of Sanctuary can do is provide that first stop, they can provide that asylum support, they can provide a whole range of community connection. But what we're able to do with Vista is, once we've received a referral, is to take that time that somebody needs to build trust. And sometimes the full extent of someone's experience takes a long time to come out. And so there are women who will be going through the Home Office system of asylum application who will not have disclosed trafficking and exploitation for a lot of reasons, shame and fear being the top of the list. So when it takes someone alongside you, it takes that alongside rather than across the desk kind of approach, for someone to feel enough trust and that somebody's there for them enough that they can start to disclose those things and then get the help they need. Which is why working with the Madai Trust, who are national referral mechanism first responders, who do an amazing job at a really good interview. You have to have an interview, an in-depth interview, going through a lot of detail to find evidence to make a national referral mechanism application. And those are the key skills that they can provide. So working together with that trust means that women are getting that support. We also, Haven picks up all sorts of lovely situations. It's those opportunities that women have to move up Maslow's hierarchy of needs, and it's an absolute privilege to watch women moving up that, if you see what I mean, starting with a kind of I'm destitute through to actually I'm starting to thrive and I'm starting to see my life change. There's a woman just started this last week, has experienced horrendous violence and abuse in her country of origin, but she speaks French. She's an intelligent woman. She's now volunteering at the Mary Rose Museum as of last week, because we went and did a visit and we had a chat with the team there. They came and visited us, and there you are, she's volunteering. That gives her that chance to thrive in our city and to give something to the city. Other women who are volunteering with us, so we have that lived experience piece, is really important. So I think what we are seeing is how important it is, and people talk about it all the time, is that partnership working, but where there's actual time taken to do that trauma-informed work makes a massive difference in people's lives, and I think, as you say, bit by bit affects the way the city responds to people's need.
Thank you. Thank you very much. Very powerful report, isn't it? The numbers are quite stark, but really good to highlight for us. Any comments or questions? No. Oh, Helen?
Mine was really to thank you for your work, because it's been phenomenal. And whilst we took a moment to thank Parks for their work when I was talking about the Violence Against Women and Girls strategy, actually you have been partners with us throughout the Safer Streets agenda since the Safety of Women at Night funding round in 21-22. And I will say that it has been an absolute honour to work alongside you, looking at the work you're doing with some of our most vulnerable and marginalised women in the city, and really shining a light on that work and encouraging us all to do better. So, and you're absolutely right. You know, we can disrupt without funding. It obviously helps.
No, funding helps.
but we must take half, from the work that you do, remind ourselves that we shouldn't allow those barriers to exist. They don't need to exist. Picking up the phone and talking to one another and working with one another is in effect free. And we can achieve so much more when we do work together. Thank you.
Can I just quickly add a huge thank you for the Safer Streets money. It's made an enormous difference to us, and thank you for the partnership that we've seen from the council. It's been incredible. It's great to know you, Caroline. I've got to know you and to see your heart for what you're doing in the city. Thank you. And I'd also just would highlight, just if I may, the work of City of Sanctuary is quite an extraordinary organisation, and not least because of Shamila's incredible drive and dedication, but there's an incredible team who work on an absolute shoestring to do some extraordinary things. So thank you.
Thank you, Chair. I just want to say again, thank you, Shamila, Miriam, really very thought-provoking presentation. But I'm just thinking tomorrow we've got the Health Overview and Scrutiny panel, and we've been working, there's a big national programme, not a huge amount of money unfortunately, but a programme in NHS, in the NHS and NHSE around women's health. And in Health and Care Portsmouth, we like to broaden and do things a bit differently. So we have broadened that agenda. So the focus nationally is on, you know, a lot of women's issues around obviously menopause, gynecological issues, but we've broadened it here. So it's about supporting women who might not have access to services. So we're doing, and I know it's something we talk about a lot, Project W as an example, is where based on feedback, women who are receiving substance misuse services, we've now got a special women-only clinic on a Thursday because obviously some of those women are in violent relationships where the partner might also be receiving services. So I'm just thinking, I'm not aware, and I just checked with Caroline whether we've reached out to you, so I'll ensure that we do, because there will be a need for access to services. We work with women in the sex industry around it receiving sexual health services, so we have broadened it. So I'll get Hannah Byrne, who's our lead, to make contact.
Sorry, yes, we do work with Hannah Byrne.
Oh, brilliant. Yeah, that's good, because I wasn't sure. That's great.
Councillor Pitt.
A really simple intervention from me, and that's to say thank you.
Thank you. Councillor Horton.
Yeah, just to add to the thanks, I mean, that was an extraordinary report and presentation, and I think it's always good for us. We spend a lot of time in meetings around budgets and stuff, and it's always really important for us to stop and feel it. It's unimaginable, some of those stories. I mean, you just hope that somewhere, wherever anyone ends up, that there's someone there to stand alongside them or catch them and re-empower them, because I think the point I want to make, I've been to the Haven, it has to be experienced really in a way, and I would say that Councillor Pitt and I often have these conversations. I try and articulate, and I'm really bad at it, the power of an all-women environment, particularly around when you're in vulnerable situations, because let's be honest, we live in the patriarchy, and to actually experience a safe female-only environment is so powerful and an investment worth making, both in time as well as financially. And as I say, I have experienced it there. But the point I want to finish on is actually one that was touched on, I think, by Shamila, which is this is not about doing two people. This is about being alongside them. And actually, we are so privileged to have these women in our city because they add to it, they enrich it. And actually, the more that we can empower them, the better off all of us will be. So thank you so much for all the work you do.
Thank you. Oh, Councillor Winnington.
Thank you, and thanks so much for the report, and thank you for your presentation today. I'd like to particularly just touch on the no recourse to public funds. A few years ago, I was a sport worker, and I had a couple of occasions where I worked with women, actually, who were no recourse to public funds. Fortunately, in neither case did they have exploitation, but what it did show, one of them had an absent partner because they were working abroad in their home country, and so were sending them money but had no other funds. And it was even more complex, and this is one of the things that I think people maybe don't understand, is that their children were actually born here, and therefore they had rights that the parent didn't, and that makes it even more complex and difficult. And in both cases they were very isolated. Worked with them, well, my purposes of working with them was to put them in touch, and this was before the Haven was around and City of Sanctuary was around, which would have been a great help at that time. But it is something that I think people do not recognise, that people are here legally, and yet they can find themselves in incredibly, even if there's no abuse or exploitation going on, they can still find themselves incredibly isolated, find themselves in really incredibly difficult situations because literally they do not have access to any funds that the vast majority of people just take for granted, and that therefore even the pathway to work can be extraordinarily difficult, because how do you start? How do you square the circle of even begin to look to work when you haven't got any? If you look for work, maybe that might take away the ability. You know, it might cause you extra cost, and so it becomes like this vicious circle. So having this City Sanctuary and the Haven available now is absolutely amazing, and as I say, a lot of the talk about City Sanctuary can be about, it's about asylum seekers, it's about people here illegally, but actually it also includes those people who are being exploited, who are here legally, and who are not being exploited and who are here legally as well. And just thank you so much, and it is an incredibly powerful document. It gives us, I think, as people who live in the city, but also leaders in the city, an awful lot to think about, is that this is going on in our city, and what else do we need to do? What else can we do as organisations and indeed as citizens to make sure that we're looking out for the signs of this going on, and that we can try and support people who are in these awful situations, when they are awful situations, have the ability to get out of them and get support, but also for those people who we maybe think, oh, well, they're here and everything's okay, but we don't understand some of the background, that we should just be a bit more aware and just be welcoming and supportive as well. So thank you so much, and it's a lot of food for thought, brilliant stuff going on, but much more work for lots of us to do.
Thank you. Thank you, everyone. That's the end of our agenda today. The next meeting will be on Wednesday, the 5th of March at 10 o'clock. And we'll see you next door at the Lord Mayor's Parlour for lunch.